welcome you all to our webinar today. Today, we're going to talk about transforming early childhood needs assessments into community impact. I'm Megan Bopp, the Senior Director at Afton Partners, and I'm thrilled to host this webinar with my colleague, Erin Arango Escalante, who is the founder of All Children Thrive. Today, we're going to hear from two communities, one in Beloit, Wisconsin, and the other in Moore County, North Carolina, about their journey to address early childhood challenges in their local context. We'd also love to start off today hearing about who's in the room. So if you wouldn't mind putting your name, your role, and where you're joining from in the chat. All right. Before we get into our panel discussion, I first wanted to share a little bit about Afton Partners. We are an impact-driven consultancy that works with our clients to transform public policies, programs, and systems, primarily through community engagement, data analysis, and collaborative design and facilitation. We've been in existence since 2011, and we've worked on over 180 initiatives in 40 states, DC and Puerto Rico, on early childhood education, K-12, and higher education, and workforce and economic development. Many of the folks on our team are former teachers, administrators, and policymakers who understand local challenges and have experience supporting communities to develop solutions. So now I'm going to turn it over to Erin, who's going to share about All Children Thrive.
Thanks so much. It is a pleasure joining you, as well as Anne, our moderator, and all of the panelists who have such inspiring personal stories and lessons that they learned in their communities that can be applied to communities across the nation. I started All Children Thrive about 2.5 years ago to do the exact work that folks are going to talk about today, using a 2-gen or multi-generational approach as a framework to center children and families while authentically identifying community level issues and co-designing solutions with our parents, our caregivers, providers and educator, community members, government, and philanthropy at the local, state, and national levels. You can see here I included a picture of my daughter with her abuelito at the center of the screen, since we're always thinking about children and families. And you can see others of those in the field, even some of our panelists today on our screen to illustrate their involvement in the co-design process and the impact in community. As a former policymaker that made a shift to an inside-outside government approach in collaboration with community and philanthropy, I strongly believe that those that are most impacted by federal, state, and local early care and education policy decisions should be included in the co-design process and solution. You're going to learn about this today. So today we will have 4 panelists from 2 communities who are going to share their journey understanding their early care and education needs to implementing innovative solutions. Thank you.
I just want to introduce Anne Henschel, who's going to be the moderator of our discussion. Hi, Anne. Anne has dedicated over 4 decades to advancing early childhood education. Her career began at Stanford University, where she served as a preschool teacher at the university's laboratory school before becoming the executive director of 2 campus childcare programs. She has since held various leadership roles, most recently as the director of early learning at the Hunt Institute, where she led policy work and programming initiatives. Currently, she's a leadership consultant collaborating with national, state, and local stakeholders to ensure access to high-quality early learning opportunities for all children.
Thanks, Megan. Thanks for the warm welcome, and welcome everybody. We're so delighted you're here. It's been a lot of work behind the scenes to put this together. We hope we're going to provide a really dynamic conversation for all of you. Inviting all our panelists to join me on stage, and we'll do a quick round of introductions before we dive into the stories from their communities. To all of you participating, we really want this to be as interactive as possible. So as you're listening to the panelists and their stories, feel free to share your own stories. If anything resonates, feel free to share that in the chat. And as Megan said, the Q&A portion, if you could put those in the Q&A box for us, that would be really helpful just so that we're a bit organized. So with that, Drew, I'm going to start off with you. Do you mind doing a quick introduction?
Not at all. Good afternoon, everybody. Drew Pennington. I live and work in the city of Beloit, Wisconsin, which is a small city of about 40,000 people on the Wisconsin-Illinois border, and work for the city of Beloit and Greater Beloit Economic Development. really started getting into childcare advocacy work as a parent when my kids were in childcare, and then it kind of carried over into my work as well. And so was fortunate enough to work with a bunch of entities on the childcare action plan that the city led a couple of years ago that we'll talk more about. Thank you for joining.
Thanks, Drew. How about you, Naila?
Hi, my name is Naila Adama. I've been a resident of Beloit for a little bit over 20 years. I started my community connections as a parent struggling to get childcare. Now as a teacher, advocate, and a community member. 20 years later with a 3-year-old, I'm having the same struggles I did 20 years ago. I was invited to join our Beloit Action Plan through some work with other organizations, and it's been a beautiful experience. So,
Welcome. As a true educator, many of us started out as parents and then found our way into early childhood, didn't we? Wonderful. Stuart, how about you?
Hi, everybody. My name is Stuart. I work for Partners for Children and Families, which is part of North Carolina's Smart Start Network. My colleague is on the phone. Linda and I are based in Moore County, right in the middle of North Carolina. Our county is home to retirement communities and resorts such as the Pinehurst Resort and Golf Club, and in Southern Pines, the equestrian area here. But most of our county is rural and undeveloped. Our mission partner is to prepare every child in the county for kindergarten. We have several evidence-based programs to provide a school nurse for every child care center and home in the county. Child care workers, just like everywhere else in the country, are really underpaid, and we provide a bonus to child care providers every 6 months. Our food program provides over 10,000 healthy meals and snacks each month for low-income children in child care homes. Over the last 3 years, we've been trying to accelerate our mission, relying on systems thinking, advocacy, fund development, and coalition building, just sort of things that we're talking about in the seminar, which I really appreciate being part of. I'm proud of what we're doing, but I do feel like this is a work in progress. We're happy to be part of the discussion. For data in our county, we rely on Smart Start's Meeting Indicators Dashboard, which is pretty wonderful. This is available to the public. I'll put a link to it in the chat in case anybody wants to take a look. We also try to walk the walk as well as talk the talk. As an employer, we're an employed employer, and we're working towards being a trauma-informed organization. Together with the Chamber of Commerce, who's represented here by Linda, we're working on several initiatives. We try share a new Center for Excellence in Child Care and become a certified family order county. We're fortunate to have Linda serve as the chair of our board of directors.
Thanks, Stuart. And a special shout out to Smart Start North Carolina, who actually they're having their conference as we speak. So really appreciate Stuart taking the time to join us today. Linda, last but not least, you would do a quick introduction, please.
Thank you so much, Anne, and thank you, Stuart, for those kind words. I'm Linda Parsons. I'm the president and CEO of the Moore County Chamber of Commerce. We are located just south of Raleigh. We are a rural community. The Chamber's role in childcare began about 3 years ago when we were working on workforce development issues, and we'll get into that a little bit later during our discussion. But for me personally, the issue became an issue 20 years ago when I was told in our community that there was a 9-year waiting list to access childcare. And those lists continue to be a challenge in our communities. So it's been a passion of mine, and I am the daughter of an early educator. So it is something that is to my heart and passion. I look forward to sharing our story with everybody today. And I want to thank everybody for their time, for being here, as well as for hosting us today. Thanks.
So Stuart and Linda, why don't you hop off and we will dive into the Beloit story. I think I'll start with you, Drew. Can you tell us a little bit about Beloit, Wisconsin, specifically around your role in the action planning project? Why did you choose childcare as your focus? I know you just mentioned that was the area you chose to target with this grant opportunity through the International City County Management Association. What were you hoping to accomplish with this grant?
Sure. Beloit is a unique place, ethnically and racially diverse place, especially for Wisconsin, medium size. Our metro area, if you want to call it that, is about 110,000 people within 10 miles of downtown Beloit. A lot of manufacturing. About 20% of our workforce is in manufacturing. Revitalized downtown with a lot of activity going on. A lot of tourism is a growing industry here as well. We have unacceptably high poverty rates. When I came into this role, we were around 18% households in poverty. And so really the timing of our childcare action plan we were already pursuing a number of opportunities, grants from the state to do some kind of plan to address it. We were hearing about it from our employers. We can't find people to work. All this familiar stories that are, probably common to those around the area or around the country. Can't find people to work. It's prohibitively expensive for households, those sorts of things. We had a new city manager come on board, and coincidentally, a economic mobility grant came up through the International City County Managers Association. We applied for it and received it. One of 10 cities. We're the first cohort to get that grant. It was a combination of technical training and funding. We used our funding to actually prepare this action plan because we, along with our chamber and other business organizations, were diving deep into the problem and felt like we needed a roadmap for potential solutions. The real advantage of our plan was getting a better grasp on the underlying causes and then putting together some short-term and long-term action plans to address it. The good news is that we have a strong infrastructure when it comes to our high school, public high schools, our tech college system. All those early childhood programs are full. The issue is that no one in any of those programs are staying in the field or even going into the field. It was a question of workforce development. So we've used that plan as best we can to launch some workforce related initiatives. For example, we funded a advertising campaign to try to get childcare workers to sign up for health insurance through the public health care exchanges. And we worked with a couple of state agencies on that. We offered training for people that are in childcare and wanted to start their own childcare center, either a group center or in-home center. We reached out to all the existing childcare centers and made sure they're aware of ARPA funding that was available. It was really a roadmap we've started to follow. We're a long way from being done, but it's a good start.
So exciting. And Naila, I saw you and I both smiled when at the end of the day, the sort of business community realizes that there's this huge turnover in the field of early childhood education, no matter where we seem to live in this country. So tell us a little bit about this idea of family childcare and the family and childcare provider voices being a priority in this initiative, in this effort. And so, share kind of what were some of your strategies that were used to engage a more diverse community, especially the busy family members and childcare workers.
As you mentioned, family and provider voice is super important to me. I've been involved in lots of things where it didn't feel like those voices, those policies that impacted people, those voices weren't listened to. We were just a check mark, a box to check to say, yep, we asked them. We didn't necessarily listen to them, but we did ask. It was super important to me that when we went into this work, those voices were lifted. Some of the strategies that we use, it's really important for me to say that the work, as I came into the work, hold on, let me plug in before I thought I was plugged in. Sorry. Okay. The work that I did through PCAC and through Kids Thrive, they always asked, are we asking the right questions? A lot of times those voices aren't asked. They ask if we have the right solutions, but nobody ever asks us if we ask the right questions. It was important to me to get people in who, yes, I've gone through the child care struggle, but I know that my struggle isn't the same as everybody's in my community. So it's important to me to make sure that we had a diversity of voices. And because of my position in the community as a parent, as a community advocate, as a teacher, I have lots of connections to people. And over the years, it wasn't overnight. Over the years, I've been able to build up some trust in building those relationships. So they knew that when they came to this, it wouldn't be a waste of their time. The biggest hurdle that we had to face as a community was letting them know this is not a waste of your time. We are actually genuinely listening to you, and that something will come out of this. First and foremost, letting people know that their voices were authentically being heard. That takes time, building up trust between agencies doing this work and the community they're serving. The other really important thing was anytime we are hosting sessions or trying to get community input, again, families are busy. We know that they care about these things and they want to be heard. So we try to make sure it's when they can participate. And we also make sure that we put our money where our mouth is. One of the things that we always do when we engage in community voices, lived experience we are borrowing from to make these policies and to create these action plans are important. And because of that, we were willing to compensate families for their time. It wasn't a lot, but it was something to let them know that this is If all else fails, if we drop the ball and we don't do what we're supposed to do, if we don't uphold our end of the bargain, you've at least not wasted your time and you're getting compensated for it. We provide childcare, and it's always good to share a meal. And so those are really key, that compensation, that relationship building, that trust, those were key in order to get the diversity of voices that we did have.
Yeah, that's part of how you establish the trust and respect, right? You're treating them with respect and recognizing that their voice matters by providing that opportunity of a stipend and childcare. I also appreciate what you're saying about that it's not just talk, that their voices led to some meaningful action, so let's go into you now, Drew. In reading the action plan, I noticed there was sort of this intentional, and I feel like Naila spoke to this a little bit, but this intentional holistic approach to addressing the childcare crisis in Beloit, including business community, philanthropic community, school districts, transportation, like so many more. Can you provide examples of some of the new allies who are engaged now in addressing the childcare issue in your community? How has this approach resulted in positive changes to childcare in Beloit?
Sure. The timing was such that we engaged quite a bit with our public school system. They are definitely an ally in this work. For example, after school, our survey showed a lack of after school care capacity. We found that there was a disconnect. Parents weren't always aware of all the opportunities out there. Our school district sent out an all district, all parent email, making people aware of specifically what schools had openings. Just something as simple as that was effective. Some nonprofits in our area started a very ambitious program to repurpose an old school into a transitional living and childcare center. They deserve all the credit for that. They raised a lot of money and put a lot of time into that. Our action plan was a part of their fundraising efforts. They used it to demonstrate the need. They used it when reaching out to donors. So we're proud of that. The city contributed few $1 million of ARPA money to that project, as well as Rock County, Wisconsin. So credit to them. It was really those types of partnerships. I asked our nonprofit partners to give their input into the plan to demonstrate the need, and then they were able to use the plan to raise funding. So there was some good relationships built that way.
That's smart. So that they actually, again, that's sort of voice and trust. So they had this relationship with you, trusted you, and you gave them voice so that they were able to speak to what you were trying to accomplish and achieve. Okay. I guess, Naila, stepping back now, so what have been some of the outcomes, I guess, building on what Drew just said, outcomes and successes that you see from this work, and where do you see as your next steps in Beloit?
As we were recruiting for this plan, there's been a lot of interest in continuing those conversations. So I think one of our biggest next steps is making sure that we really leverage the community into next steps as we're going through this process and use the action plan to make changes. Are we making sure that we're looping back and keeping those lines of communication open to the people that this is going to be serving? And I see the fact that parents are calling me like, when is the next meeting? When are we going to? That's huge in our community. They feel empowered and engaged. That's like a win, but it's a huge win for us. The other thing, that something that came out of our impacts plans and our conversations was our transportation issue. People were like, you have childcare available, but it's not accessible at certain times of the day, depending on what type of job you have. Or if you don't have reliable transportation, even a bus route could make or break whether or not you could utilize that center or that care provider. So using those conversations and then going back to our partners, they've made some adjustments to those kinds of things. So the things that you don't think about that are not just childcare, but again, wrapping around the whole family and the entire issue, those conversations being open and our community partners being open to hearing them has been awesome.
So they actually adjusted the bus routes?
Yes. Yep. So we don't have a huge city bus, huge public transportation, but the ones that we do have weren't really doing it for us. So they looked at those conversations and made some adjustments.
I guess that's what you mean about holistic. There was one question. We've got just a couple minutes left before I'm going to switch over to Moore County. Somebody's wondering, can you identify some of the data that demonstrated the success of your project? Are you there yet? Do you have data, or are you still sort of a work in progress?
We're very much a work in progress. We haven't looked at our childcare capacity and whether that is grown. I mean, anecdotally, it's stabilized. We had a wave of closures of childcare centers that led to this whole effort. We do have one new center that opened that's licensed for 70 children. So that's a huge win for us. That's part of our action plan, is to go back and take a look at where we are. We would love to get to the point where we can provide more direct assistance to childcare providers, which is a recommendation in our plan. But the funding for that is a whole bigger conversation. It has reached the state level too, as we have some state programs that have stabilized the industry that are due to expire. So ongoing conversation.
I think that's fair. I sort of always knew the answer to the question, because I think that's probably true for every community at this time. All right. Well, thank you both. We'll see you in a bit. I'm going to invite Stuart and Linda to join. While they're joining us, again, I just want to remind you that we are going to transition to the Q&A. So if you have any questions that are popping up, please add those to the Q&A box on the Zoom toolbar. Feel free to chime in if there are things that resonate for you. All right, so Stuart and Linda, let's start with you, Stuart. I know you, in your introduction, you shared a little bit about North Carolina Smart Start and the Partners for Children and Families in Moore County. If you want to sort of elaborate a little further on that, you're welcome to. And what would you recommend as a starting place for those that are in the audience listening today and they're just trying to sort of figure out how to engage their community? What would you recommend as a good starting place for any local leader trying to address the needs of young children and families in their community?
Yeah, sure. Thanks, Ann. The Smart Start Network is about 30 years old. It's a relatively innovative solution to a serious problem, having children show up to kindergarten unprepared to learn. Through our Smart Start Network, our state tries to combine public resources with private resources and with lots of knowledge about the individual communities. Each of our 75 partnerships is a separate public to private partnership. I shared with you already the link to our data dashboard that we use. Another key component of our approach is our list of evidence-based programs that can be run and funded at Smart Start. And I'll share with you a list of those smart solutions in a link in just a minute. There are hundreds of programs to choose from, but we in Moore County layer on top of that a bunch of other things, including a federal program that provides food to low-income children in childcare homes. We are very much a work in progress, so I'm hesitant to hold us out as the best way to do things. But I guess I'll try and answer your question. For local leaders, what I'd suggest if you're just starting is, gathering data on the needs of your local children, even doing some direct sampling, which we do from time to time. Then do some systems thinking, identifying and diagramming all the resources for families in your county or area. In our county, that includes Smart Start, that includes Head Start, that includes NC Pre-K, the child care subsidy, a list of probably 10 different things that are being done for children. How many, what kinds of child care facilities do you have? And then I would do some benchmarking against comparable counties. We try to look at other mid-sized North Carolina counties and a few counties outside the state as well. And we also try and compare ourselves to other economically similar counties, other tier 3 counties in North Carolina. As you go through the systems thinking exercise, you may identify areas of overlapping services, although that's pretty unusual. More likely, you'll find areas of gaps in services. If you look at what level of the federal poverty each program covers, are they overlapping or are there big gaps? You'll almost certainly find individual components of the system that are detached a little bit from the rest of the system. And one of the arts is to try and get those programs to work together with the rest of the system in your county. You won't be able to address all the needs identified by doing the systems thinking, but you can with your partners establish some priorities and some sequencing. This is the biggest problem. Let's address this first. And then moving on the next year to another problem. In our case, one of the things we're working closely on is the fact that we have fewer NC Pre-K slots. in Moore County than in the other counties in the state. On the other hand, we have more developmental day centers in Moore County than much larger counties like Mecklenburg. So there are good things. There are other things that need to be addressed. And that's kind of the analytical way that we look at it, but you need to do it with partners like the Chamber of Commerce, who's represented here today.
That's great. Thank you. I'm recalling a conversation that you and I had, that this idea of the systems was really important, that it felt like there was just so many different variables coming at you. And I think you said you even brought somebody in from the outside that could like help with that systems.
Yeah,
work.
I
Is that
think
right?
you got to remember that people outside, the early childhood area, they can't distinguish in their own minds, particularly if they haven't had young children in a while or never had young children. It's difficult to distinguish Smart Start from Head Start, parentheses pre-K. What's the difference between a child care center and a child care home? So you need to be able to describe the system to your county commissioners so that you can then explain where you think there are holes in the process. We have hired a consultant that we're still working with her on helping us engage more directly with the county. We have certain events over the course of the year. The county has certain meetings over the course of the year. How do we integrate those two schedules? For instance, if we're having an NC pre-K graduation, wouldn't it be nice if some of our state legislatures and our county commissioners might be present? They might very much enjoy being there, and they might start to think about when they're making policy decisions. It's not just a K through 12 or university question. They ought to start by thinking of the 0 to 5 population. And the neat thing about the 0 to 5 population, the parents care as much as anybody else about their children and the welfare of the county, but they are also fully engaged in their professional careers and in raising children. And they may not have time to show up for lots of meetings. They need somebody to advocate for them. I sort of view that as our role.
Okay. You've set Linda up beautifully for the next question. Linda, tell us what a Chamber of Commerce does and why you're collaborating with Stuart on childcare issues in your community. I know you've got a personal attachment with your mother as an early childhood educator, but I know there's so much more that has led you to this place. What's an example of how you've helped educate business leaders on the importance of early childhood services?
So a lot of people may think they know what a Chamber of Commerce is. And we always say, if you've seen a Chamber of Commerce, you've seen a Chamber of Commerce. Chambers have been around for over 400 years. And they were started in France, and in our country, they were started before the Declaration of Independence. But the ultimate mission has always been the same. We advocate for business. We ensure we have infrastructure, and infrastructure can mean childcare, roads, bridges, water, and we shape economic policy. We did that 400 years ago, and we still do it today. And regardless of the size of the chamber, whether you're in, I think I saw some Colorado and California listed in the locations, we all have a passion to make sure we have an economically vibrant business community. So saying that, the chamber post-pandemic felt it was important to do an employer survey. And that survey was trying to design retention and recruitment for our employers and what issues were they seeing post-pandemic. Not surprising, everything from housing to childcare to I can't find employees, transportation issues, can't retain employees, all of it came out. And so as a chamber, we were able to focus on those different issues, and we have different divisions doing those things. But as it relates to childcare, it created the conversation for employers to learn how they can help retain and recruit employees by learning more about family-friendly practices. We created the Child Care Task Force and brought employers to the table. I actually see on the chat that one of my task force members is here today. And because of that, we were able to bring in examples of success throughout our state and our country. We were able to talk with our employers about the different things that are working or not working, and to just start the conversation with them. And so that's been a 3-year process. And we continue to do that. We continue to educate. We share stories and studies, which I'm going to drop a link of some North Carolina studies that recently were released. And I think it's important to myself also educate. So I did a lot of reading with different groups of why is it important to have early education? Why is it going to be long-term important to our employers? And so understanding all of those things so we can communicate it to them so they have successful employees, whether it's in 5 years, 10 years, or 18 years when these individuals are entering the workplace.
Great. Yeah. Well, very well said. How fortunate they are to have you in that leadership role and being able to articulate that. Stuart, I personally think that this next question we could have just done a whole webinar session on. So you've only got about 3 minutes to answer. Do your best. Can you share about the initiatives that are happening in Moore County? Specifically, I'm interested in the Center for Excellence in Childcare and the TriShare pilot. For those joining us, TriShare is a pilot project that North Carolina has identified, but it was modeled after the state of Michigan. So shout out to Michigan. But Stuart.
Well, let's start with the Center for Excellence project that Glenn and I have been working on together. We have a community in this county, which was a prosperous, separately incorporated African-American municipality. It was one of the first African-American communities incorporated in North Carolina after the Civil War. Sadly, that municipality was eventually annexed into a larger community during the Jim Crow era, and the zoning was changed so that over time, the circular economy of that town eventually disappeared. And approaching this from a childcare perspective, we're trying to be part of the solution for that community. We formed a task force that consists of the Chamber of Commerce, our partnership, our community college, and others, with the purpose of renovating 2 unused school buildings in that area, one to become a 70-80 slot 5-star childcare facility, another to be a presence in that community for the Partnership for Children and for our community college. The childcare center would be a lab school for the community college and for the Partnership for Children. There's a lot of enthusiasm behind this project, but we're going through the fundraising process now, so it's a little too early to be proud of it. I think it's a good idea, and we're getting support from all quarters, but we need to raise the money for it. This is simultaneously an economic development program, childcare initiative, but also a justice initiative trying to set things right in that community. So that's the Center for Excellence project that we're working on together. And then the TriShare project, you mentioned how it works. The basic idea is if an employer will pay for 1/3 of the childcare costs of an employee's child, then the state will pay for 1/3. Childcare costs are outrageous on average in this country and in the state. For instance, in North Carolina, the average childcare cost exceeds the tuition for in-state students at our flagship state university. This is a way of dividing the costs and making them manageable. We're piloting that project right now for Moore County. We were pleased to be selected as the pilot county. One of the reasons we were selected is because of Linda's child care task force, which we've been working on, because we could together with employers, be watching that legislation make its way through the General Assembly and ultimately become law. And we were able to become one of the pilots for that program. One of the things we're finding, though, is that it's taking time to implement it. What I'm told by Human Resources is it takes about 1 year to 2 years to sell a new employee benefit to an employer. And that's exactly what we're experiencing. I'm confident this is going to be a successful program if we have the stick-with-itness to keep working on it and let it run through the employer's budgeting systems and human resource systems. But it's a great program that we can work on together. And we wouldn't have had the context with the employers if we hadn't been engaged with the Chamber of Commerce.
I know it's similar to Beloit. There's so many different parts and pieces to the work, and it's hard to sort of capture it. But I think that gives at least a couple of concrete examples. Linda, final question for you is just kind of how is the Chamber, what's the role been with business leaders? I feel like you spoke to that, but also with the legislators around these initiatives and others related to young children and families.
I think through the task force, we've been able to educate the employers and then provide them tools and data and stories. They were able to do some of their own childcare surveying. We conducted a childcare survey in 2023. Employers have started to do the same. We've been able to provide that information and then use that information to go back to the legislators and say, here is some data that's working, whether it's to help with recruitment of teachers, whether it's for employers just to understand the basics of things have changed and childcare is expensive. And whether you have a child with a disability, whether you have a child that's abled, whether you're dealing with an elder parent, care is a deal with employers. And I recognize today we're focused on children, but care overall is something that employers never really had to think about. And so by educating and putting it out there through newsletters, conversations and one-on-ones with our elected officials, as well as the leaders on Stewart's board, we've been able to elevate it in our community as a topic. And we have been featured on several different things around the state that help us continue the conversation, and our legislators are looking at it. And it's becoming not a faux pas topic, shall we say. It's one that's important to recruit and retain talent and ensure we have a future pipeline, which is extremely critical to my organization and who we represent.
Thank you. All right, I think we'll go ahead and move on into the question and answer period. So why don't the two of you hop off stage for a moment? And I think we'll bring Aaron and Megan back. They can let us know what questions are surfacing from participants. Hey, Megan.
Hey, Anne. We've got a question in the chat from Nicole. She thanked our panelists and was curious about how their planning process considered the needs of children with disabilities, including access to inclusive childcare and early intervention services. Were there specific strategies or partnerships incorporated to support these children and families?
All right, so panelists, anyone that sort of wants to take that, or there? I thought Megan.
Hey, y'all.
Perfect.
Was there anyone else?
No,
So
that's good. Go
I
for
can
it.
speak to the work here in Beloit. Many of the parents, that is something that came up repeatedly in all of our work, but even in our action plan, our supply action plan. And it's something that was considered, and it's something that is an ongoing conversation that I don't know if people were aware, like you said, with the children with disabilities. We have so many children with autism. We do have a new center to help address the needs of young children who aren't school aged, who need that specialized care. It was brought up as far as getting certain training for in-home providers. But again, it's an ongoing conversation and not taboo anymore. I love that you said that, Linda, like bringing these things up and letting them know these are everybody's issues. So we don't have a clear plan for that, but we know it's an issue that needs to be addressed within the scope of providing accessible childcare for all our families.
Especially now, there are so many children since the pandemic that are being challenging behaviors in addition to getting identified with any kind of, neurodivergent.
Neurodivergent, trauma-informed, those are all things that we make sure that they know
That's
that
very
these
real.
issues also need to be addressed. Because a
Right.
parent can't stay at work if they're being called to take their child home.
Right. Linda, I see you joined us. Do you have some thoughts on this conversation?
In our community, we have several developmental day centers. We're very fortunate to have that, and they've been at the table and on our task force on a regular basis. That is important for us. And as a chamber, we recognize individuals with IDD are very important. One of the things the chamber is doing is IDD training this year. We are hosting trainings for our business community, and we're very excited about that. It's everything from adults to children. And it's something that I think is important, and you are correct, is often not brought to the table. It's a process. Everything's a process. It's something that not all communities are talking about, but I do think it's something that is important that needs to be added to the conversation.
Thank you. Okay, it looks like another question just popped in. Megan, what is that one? Oh, you're on mute.
Thank you. The next question is, I'm curious to what data sources were used in the development of your plans.
I'll jump in here real quick. Some of my data was provided from the U.S. Chamber, recognizing that they were starting to talk about it. Some of it is honestly from Stewart's organization, seeing the reduction of total centers in our community and starting to see that as a red flag for retirements. People were closing, which is understandable. Everybody has the right to retire and go on to their next career path. That was helping us to set the stage to determine our next step. That's when I started to rely on Stewart's organization for some of the data that was needed.
We've just got about a minute or two left. Stewart, anything you want to add around the data?
Earlier in the discussion, I put in a link for the principal data source that we use, the community indicators from Smart Start. On the disability question, we will eventually put out a request for a proposal for an operator for this new child care center in West Southern Pines. That will be part of what we're looking for in proposals, what the proposals we accept. first that they will be focused on that neighborhood, which is one of the neighborhoods of greatest neglect, but also that it would be nice if this would be another developmental day center, because that's something we believe quite strongly in their economy and something we seem to excel at. Our child care health consultant is very much involved with in providing nursing services to all types of children, and that's a big part of the component. We're also working to try and develop a new nursing position for an opioid consultant, because there's funding available through the opioid settlements, and it's also something that is still a challenge to families in our county.
I noticed my colleague Matthew from Santa Clara County, California, the Office of Education there at Santa Clara County, just shared a link as well. So I just want to highlight that for folks as another possible resource. Thanks, Matthew. Drew, anything you want to add to this conversation?
Well, on the data piece, I mean, we relied on a lot of publicly available data, and Aaron could speak to this too, since All Children Thrive did our plan. Publicly available data in terms of spots in childcare centers, census data. Public school received a fair number of responses from our school system, the financial aspects of that. We have a whole section of our plan on 4-year-old kindergarten, and that will require more than a minute, but that's super complicated, right? And how that has impacted childcare is an ongoing conversation piece in Beloit.
I know there are several people from California here, and I can promise you they have lots to say about transitional kindergarten. It's something that they've really led the way on. So might be opportunities for some networking there. Thank you, Drew. I'm going to hand this over as we're wrapping up to Aaron and Megan. Aaron, in closing and thinking about this discussion, I know your work focuses on elevating community voice, as you were saying in the introduction, but both inside and outside of government. Do you want to share why this approach is essential to policymaking and should be a first step for any local community?
Yeah, and I'll be really brief here and just say, you heard with Naila and Drew the importance of really hearing from those most impacted by the decisions that are made inside and outside of government. And the example of transportation being an issue, had we have not asked these questions and really peeled back the onion to get at some of the issues, we wouldn't have known that the bus stops were changed, that the hours of transportation were changed. And that's a really good example of why it is important to first build relationships and work closely with parents, caregivers, and educators as you develop that inside-outside strategy. I wanted to share that one example again as a reason for elevating those with lived experience in community as your first step.
Thank you. Yeah. And so you're sharing that is part of the sort of essential approach to policymaking, and it's and with.
Yeah, you can't do it without, right? It is a piece where you have got to do it hand in hand, and building a very large table that includes your policymakers, that includes community members, that includes parents and caregivers. Without it, I think that you potentially waste time, waste money, misalign your resources. There's a whole snowball effect that impacts our children, families, childcare providers, and has a ripple effect beyond that in terms of the economy and so on and so forth. So that first step of including those that know the issues and have ideas for the solutions is critical when you're looking at that inside-outside strategy.
One last piece of this conversation, then I'll turn it to Megan. I remember when we first started this journey months ago, that you had shared something of how you also, Beloit was very fortunate because there was state, am I right, that there were people within the State Department, I believe, that were also family members. Can you just share a little? Because I thought that sort of, often things come from state legislators to the community, but here, anyway, just where I'm headed. If you could just speak
Totally
to
where
that.
you're headed. And I will give the example of our good friends on here, Naila and Drew, where they were connected in community and at the state level. And what's important is that ideas from the community were pushed up to drive what happened at the state level in terms of policy. There were some key learnings in Beloit that are actually driving policy at the state level versus that more top-down approach. I can give many examples of it. It's happening it's real and it's example that is happening both across the state and in other pockets across the nation. So happy to chat more about it. I could go on forever,
Yeah.
but it's exciting.
Yeah,
exciting.
it's exciting. It's important. It's a bit of a secret sauce, don't you think?
It's the magic. Yeah.
Yeah. So Megan, your team at Afton works with communities across the country. I happen to know of several of the exciting projects you're doing. As you're sort of reflecting and listening to today's stories, what captures your attention? What approaches does your team use to support these communities?
Thanks, Anne. Yeah, well, I think a lot of our work focuses on communities and data. We build off of what Erin said of working in communities with communities, engagement being a really key part of the work that we do. We're doing strategic planning. Stuart was talking about some of the quantitative data that you need to tell the story, but you also need the story of people who are impacted. And we straddle that line and work both in the quantitative and the qualitative data and help bring meaning to both sets of data. I appreciate Erin's point on really starting with the stories of the community as being essential. I do want to share a little bit about our approach that we take at Afton and sum up some of the steps that we take. So you can see the slide here. We work with communities across the country, and we are really focused on helping people move from insights to impact. And so what we wanted to share here is just some of the steps and questions that guide the process. Like we heard from our panelists, the first step is figuring out who are the right people to build momentum around early childhood in your community. So these are often people who want to prioritize ECE and engage deeply in the issue. From there, we move into setting goals, looking at data, laying out steps to achieve a vision, and planning the resources to get there. And as I mentioned, what we find in our work is that it's particularly important to have a diverse representation from the community and building a coalition. We heard this a lot from our panelists today, as well as when we're reaching out to community members and learning about what the challenges within the community. And then, as we talked about today, moving from this first column to the second column, from insights to action, really requires skillful implementation and coordination. And so what we listed here are some of the key things we think about, such as establishing clear roles and responsibilities, monitoring and accountability, and considerations for the future, which includes sustainability and scaling. So this is a representation of a high-level summary of a very complex process that our panelists have experienced, and many of you listening probably know about as well and experience day to day. And we just wanted to also share appreciation for those of you who are doing this kind of work and advancing from insights to impact. So that,
You know,
go ahead, Anne.
well, I just want to sort of, in conclusion, I had the opportunity in my previous role to work with Afton. There is a way in which you bring the data and the stories to life in this sort of rich, meaningful way that I don't, at least in the various roles I've had, I didn't necessarily have that skill set. So to have real gratitude for all of you. And also just given the time that we're living in right now, this notion of the local level. So all of you that took time to join us today, that important work you're doing for the young children and families in your communities is so vital, and really genuinely appreciate your taking the time to join us today. Final word, Megan?
Yeah, we just want to stay in touch. So we've got our websites up here. Erin's going to drop our email addresses in the chat. If you have any questions, want to talk further, we'd be happy to continue the conversation. Thank you for coming today.
Thanks, everyone. Take good care.